Hello, I'm Drona Rasali speaking from Vancouver, which is in the traditional lands and unceded territories of Coast Salish peoples, including Musqueam, Squamish, and Tsleil-Waututh nations. In these collaborator sessions, I, as the chair of CARRFS Organizing Committee, am so pleased to thank our session moderator, Celine Plan, and other two honored speakers, Dr. Christine Blazer and Dr. Sharmista Mishra, for their valued contributions to make this session a great success. For my own part of the presentation, I will be focusing on the topic of area-based socioeconomic disparities of COVID-19 in British Columbia. COVID-19 pandemic became the magnifying glass to look at the socioeconomic disparities around the world. The vulnerable segments of populations were more prone to have COVID-19 infections and associated hospitalizations, ICU care, and even deaths. I'm especially talking about British Columbia's case here. In British Columbia, we are closely examining geographic, demographic, and socioeconomic disparities of COVID-19 in various streams of our efforts in the pandemic response. Here is the outline of my presentation. First, I'll be touching on provincial overview of the COVID situation in British Columbia, then spatial distribution of COVID cases in some parts of BC, then area-based socioeconomic and socio-demographic analysis, and some conclusion. Here in this slide, I'm presenting overall picture of COVID-19 disparities in terms of COVID-19 test positivity reported across various demographic groups by sex, household size, living alone by age group, and immigration status. This comes out of the results of a survey, provincial survey of COVID. It's called BC Speak Survey. What we observe here is higher the household size, higher was the test positivity reported. And newer Canadians appear to have higher test positivity, while younger adults living alone also have higher test positivity. Here in this slide, what we observe is income did not show up as a very strong dimension to demonstrate the COVID-19 test positivity. While the people with educational attainment with only high school showed higher test positivity than the university degree holders. In terms of race, ethnicity, South Asians showed up with higher COVID test positivity compared to others. COVID-19 disease data, like any other disease data or healthcare utilization data collected in the health administrative databases, do not come with individual level, patient level socioeconomic data. So we needed to resort to using area-based socioeconomic data linked with the COVID-19 cases. Several studies from area-based analysis of COVID cases examining socioeconomic and socio-demographic disparities have been reported right from the beginning of the pandemic in various parts of the world. I'm citing here a couple of reports from the US studies where differential rates in Black and Hispanic populations were reported compared to white populations. And the correlation analysis between these factors have been also reported. In our study in particular, we investigated socio-demographic disparity in the lower mainland of BC that has 60% of the populations in the province. Here in this slide, I'm presenting the spatial distribution of COVID-19 cases in BC's lower mainland. Especially what we observe is higher concentration of COVID-19 cases in the heavily populated areas of especially Surrey City. Here in this slide, I'm presenting the correlation analysis results using Kendall's correlations analysis. We observe in this particular slide, what we see is the positive correlations of COVID-19 incidence rate with the neighborhood census level, DA level, dissemination area level proportion of the people with less than high school education, while reverse relationship, that is negative correlation, was observed with the proportion of the people holding bachelor degree. Here in this slide, what we observe is area-based COVID-19 incidence rate differences or disparities by race or ethnicity. What we are observing here is the proportion, higher the proportion of the South Asian people in the neighborhood population, we are observing higher rate of COVID-19 incidence rate. On the reverse, in the case of white population, higher the proportion of the white population in the neighborhood, we are observing lower cases. So this has negative correlations. Similarly, in this slide, we are talking about occupation. As shown in the slide, we observe positive correlation of COVID incidence rate with the neighborhood DA level proportion of people working in the occupation, such as manufacturing and utility, trades, transport, and other operations services, while negative correlation was observed with proportions of people working in management occupations. In conclusion, neighborhood concentration of certain minority groups, especially South Asians, low-level education, and frontline operational service occupations are important factors to consider in the COVID-19 response. Here, I have tried to show some examples of socio-demographic disparities, especially the association of education, race, ethnicity, and occupations with COVID-19 infections across populations of BC at the ecological level. The findings are consistent with the reports from other international jurisdictions, and health disparity exists in the society, and it has been exacerbated by COVID-19 pandemic, which has served as the magnifying glass to look at the disparity vividly. Finally, I would like to acknowledge the members of our various teams at BC Center for Disease Control, a part of BC's Provincial Health Services Authority, for their valuable contribution to surveillance of COVID-19 at various levels to support the pandemic response in the province. This work has made this analysis possible as part of surveillance work. Thank you so much for your attention.